Welcome to PRP Talks. I'm Dr. Stacy Haynes. Today we're in the Birmingham office and we're talking about platelet-rich plasma for hair rejuvenation. I have Ashley and I have Angela, and they become very just a pro at it. We have done several, quite a few, a lot. Let me just get it right. We've done a lot of platelet-rich plasma for hair rejuvenation. Our patients are very happy. So we thought that we would just talk you through the whole procedure and how it goes, so that way if you come to visit us, or shall I say, when you come to visit us, you'll feel very comfortable.
Yes.
And it always starts with Angela.
Yes, I'm the bad one. We usually get the patient back, make sure they sign their consent, and then I would draw the blood, and then we'll go from there.
Right. So actually, she's very good at drawing blood. What I call you today? Sure shot? One shot, sure shot? Because she's really good. It only takes her one time. She puts the needle in, blood's there. You turn your head, and you really and truly don't even feel the blood, unless, of course, you cross her the wrong way. But
I will warn you.
And so that means after you're back, they get the blood drawn, we spin it down.
And then from that point, we numb the patient. We apply a topical anesthetic for approximately 30 minutes. After 30 minutes, we'll clean the scalp and then forewarn them for Dr. Haynes to come in.
Yes, and then I come in. I'm the bad guy with this one. Stop shaking your head. It's not that bad. We actually let you sit up in a chair. It's just easier for you. It actually gives you something to lean against, and it gives you something to hold on to. With the platelet-rich serum, we do the blood, we spin it down, we take the serum, and from the serum I activate it and I actually inject it into the scalp. The injection part is kind of interesting. The numbing cream takes the edge off, so you really don't feel the needle stick, but you feel like that tingle sensation or sting sensation, and it has like a pressure because we're putting fluid in a tight space, so you have that pressure sensation. Sometimes after you put it in, and you tilt your head a little bit, you can kind of feel the plasma kind of running through the scalp a little bit. It's kind of interesting feeling, but it doesn't last but for an hour or two, and not even that long usually. After we do the injections, we then do something called a micropin. And the micropin is a little instrument that has, shall we say, multiple small pinpoint needles on it. And then we go through the entire scalp. It turns you a little red. You'll see it on some of the videos, but it makes little openings, so little puncture wounds all over the scalp. So why is this important? Because then we take more of your platelet-rich serum, we apply it to the surface of your scalp, and then at the end, I massage it in. Now, most people enjoy the massage. They don't ever want me to stop. They're like, oh, do some more. And sometimes I do, but other times I have to keep moving. So we massage it in until the area is dry. The biggest question I get from most of my patients is, when can I wash my hair? Well, it takes about 3 to 4 hours for all those little openings to close up. So anytime after 4 hours, we'll say, like, if you really need to wash your hair to go on. This is a messy procedure because the anesthetic is in a cream base, and we have to use wipes and gauze and alcohol to get it out. So your hair will be a little messy. If you are skin of color, make sure you plan to go to your hairdresser the very next day. A lot of people will plan to have the procedure done like at this time of day, 3 or 4 o'clock, so that way you can go home and get up the next morning, go to your hairdresser. If you're Caucasian, then, or skin Fitzpatrick type 1 or 2, then you can get it done. 4 hours, take a shower, wash your hair, go about your business. Most people don't experience any tenderness or any headaches or anything associated with it because it's all you. It's 100% serum. It's your own serum that we inject and apply to the surface. So far the results have been good. We haven't had any complaints, no side effects. The next question is, when can I have it done again? So it takes about 8 weeks. Essentially we're laying seeds for the seeds to develop and to grow. That's just the best way to think about it. So anytime after 8 weeks, we'll let you do it again. So usually around 10 weeks, 8 to 10 weeks, we'll say, hey, come on back in, let's get your second one. After your second set of injections, then we can decide if we need to do it again or if we want to do it again, and then we can set that up. A lot of times we'll couple this procedure with our oxygen scalp treatment, And oxygen is wonderful because it increases the blood flow and the blood supply, and it gets us moving even quicker. So give us a call.